If you wear glasses but wish you had the freedom to see without them, laser vision correction might be an option for you. Our next guest has performed more than 11,000 procedures and has helped people enjoy all sorts of activities from skiing and scuba diving. Joining me now from Liberty Vision are Dr. Jeffrey Gold, a board-certified surgeon, and his patient, Bruce Beal. Gentlemen, thanks for being here.
Thanks for having us back.
Thank you, Teresa.
All right, Bruce, let's talk about your procedure. What did you have done?
I had what is called Epi-Lasik surgery because I was nearsighted, so I could see close, but I couldn't see far. I had to have my glasses on. And with my profession, which is a play-by-play announcer, it became very burdensome to keep flipping my glasses on and off. And so I had monovision, and Dr. Gold assured me that everything would be fine. I had astigmatism, so I wasn't sure if I could actually get it done, but I'm incredibly pleased with the results. It's made my life a lot easier doing my job.
That's great. Now, why did you choose the Epi-Lasik?
I think because it's less to do with it. I mean, I know it's just a little laser that doesn't, there's no cutting involved. And to me, it seemed like much more easy procedure to do than getting my eye, sliced, which I know people still do it, but this seemed like very, very, I wasn't worried about it at all. He made me feel at ease about it.
So you would definitely recommend the procedure?
Oh, absolutely. Best thing I ever did.
Now, Doctor, why was Bruce a good candidate for Epi-Lasik?
Well, his major problem was at work. He would be trying to spot the play, look at his notes, write things down, flipping his glasses up, flipping his glasses down, and it made him crazy.
You're probably missing other plays in between, right?
Maybe.
You never know. Doctor, explain to us the difference between Epi-Lasik and LASIK.
Okay, let's use this model.
Okay.
In LASIK, the eye is cut, the cornea is cut, a flap is folded back, the laser changes the shape of the bed of the cornea, the flap goes back down, the edge seals overnight, but the interface from here to here never fully heals. We learned in 2011.
Okay.
With Epi-Lasik, there's no cutting. We just remove a thin sliver of the surface of the eye, and I think we have a graphic that shows the difference between the two procedures. The Epi-Lasik on the left and the LASIK on the right with the flap cut open and folded back. So Epi-Lasik is incredibly safer than LASIK because there's no cutting and there's no flap that could potentially get dislodged with a blow to the eye for the rest of the person's life.
Okay. Doctor, what are some of the questions people should ask prior to having this done?
First, they have to find out if they're a candidate, and so we do free screenings for that. There are a couple of corneal diseases that prevent people from safely having this surgery done. So they need to know whether they're a good candidate or not. Then they need to know how many procedures the surgeon has done. And at least in the thousands would be an effective number for the patient to feel confident that the surgeon really does know what he's doing.
So 11,000 is probably pretty good, huh?
Yeah, 11,000.
You felt pretty confident with that, Bruce.
Absolutely, and you're in and out of there. There's a couple of pre-op things you have to do, but the day of the surgery, you are literally in and out of there in about 45 minutes, an hour. You sit down and it happens so quick, and it really is. After you're done, there is no pain at all. That's
great. Doctor, what are we looking at here? This is kind of before and after?
This is a before and after picture of Lindsey Vaughn, who is the spokesperson for the Better Vision Network, of which I'm Connecticut's only provider. And in the picture on the left, she's seen blurry. The picture on the right, she's seen clear. So that would be before and after surgery. She had LASIK. And
oh, wow, that's dramatic.
This is one of my own scuba diving pictures, as I used to see it before I had surgery, and as I can see it now. Picture of a great seahorse in the Cayman Islands.
It's impressive. Doctor, tell us about the special you have for our Connecticut-style viewers.
Anybody who calls us and mentions this program gets a $200 per eye discount. And we've just recently announced a new special that we have for active duty and military veterans and first responders, where they can receive that same discount, $200 per eye.
That's great. Very nice. Bruce, I just want to ask you, what's it like waking up first thing in the morning and being able to see? Well,
it's the holidays, right? It's Christmas.
Sure.
So I feel like I've been given the gift of sight.
Oh, great.
Really. Sometimes I used to wake up with my glasses on my head as well. And, they get crooked and you have to replace them. It is a godsend. I couldn't ask for a better Christmas gift.
Oh, good. I'm so happy to hear that. All right, let's put the information up on the screen. If you want more on Epi-Lasik, contact Dr. Gold at Liberty Vision in Hamden or visit libertyvision.net. And you can also find Liberty Vision on Facebook. Very good. Gentlemen, thanks so much for being here.
Thanks again.
Thank you.
All right, coming up next, Neil Fuentes shares a delicious dish when Connecticut Style returns. Don't go anywhere.